innovative and potentially contributive research. Our aim should be, in fact, to push ourselves and our colleagues creatively. And we're working this term to complete an inventory of internally funded research to ensure that the largest possible proportion is invested to foster and support creativity, especially high-risk creativity. As with our educational enterprise, it is evident to me that the state of our research enterprise is strong, and to the extent that we can continue to support this kind of creativity, the future will be bright. Consider next our healthcare enterprise. In healthcare, world-class tertiary quaternary care has been the hallmark of Emory's academic medicine and continues to thrive on Clifton Road, at the Emory Midtown campus, Grady Hospital. In fact, just last week we received the news that the University Health System Consortium ranked our two big hospitals to be number 10 and number 11 out of just over 100 teaching hospitals throughout the country. That's top decile performance for quality. We need to congratulate John Fox and Bill Bornstein and, in fact, the entire Emory Healthcare family for that. Clifton Road last year, we opened the new Claudia Nance Rollins building at the Rollins School of Public Health. A new health sciences research building is coming out of the ground. Two new facilities are being planned, planned and executed at Yerkes. We resumed building new clinical and hospital facilities to modernize and transform the experience of our patients, as well as our physicians, nurses, and other staff. In fact, we had put this large new clinical facility on hold. It's a multifaceted, decade-long project, but the past couple of years weren't the times to proceed. The trustees, though, last spring said it's time to go forward, and they approved the resumption of the planning, and we are now in the first phase. Also last spring, trustees approved creating a joint operating company between Emory Healthcare and St. Joseph's Hospital, aimed at strengthening and better coordinating clinical care for patients in our part of Georgia. The shared values of our two healthcare systems, as well as the opportunity for a more rational delivery of services, make this partnership a great fit. And more importantly, we look for ways that this partnership can enhance the academic component of our health sciences, strengthening Emory's leadership in such areas as neurology, orthopedics, cardiology, transplantation, and oncology. I think you know this, that not all great universities bother themselves with hospitals, clinics, and schools of nursing, medicine, and public health. Think of Princeton, MIT, Berkeley, those kind. Those of us that do, however, often are places of two cultures, the health sciences and then the rest of the institution. Historically, we at Emory have been tempted to think of ourselves this way. Two entities divided by Clifton Road, so to speak, more or less, with healthcare on one side and the university so-called on the other. Yet the mission of healthcare and our missions in professional studies and the liberal arts are actually closely intertwined, and both halves of our university depend on each other significantly for support and for lifting each other to higher levels of excellence. Since stepping into the role just a year ago, Dr. Wright Kaufman has demonstrated both a keen understanding and a ready commitment to guiding the health sciences enterprise